So I was doing this series on things that I will never do now that I've been a nurse for 10 years and seen all these terrible things happen from various things. And I decided I would make a video on what, if I was a hospitalized patient myself, what I would do in various situations. First, whenever physical therapy comes by, I'm working with them, even if it's at the minimum of sitting up at the side of the bed. The physical therapists are the people that are and the occupational therapists are people who are going to help you make some really good progress to get home. And people skip therapy sessions because they're too tired and they don't want to, but really, like those, I would be resting up for them, maximizing them during, and resting afterwards. And if it's very painful to do physical therapy, I would ask my nurse for, if I was on pain medicine, for a dose about 45 minutes before therapy was going to come by. If I was having a really emotionally challenging situation, if I was feeling like a mental breakdown coming on, I would ask my nurse to page the chaplain. The chaplain, while they typically, are trained in, divinity and that kind of stuff, one thing that hospital chaplains are trained in is helping talk people through crises without preaching or without telling them biblical stuff. Their training as a hospital chaplain is just to help people talk through stuff. So if I was having a tough time with a decision, if I was just I need to talk to somebody, I would call and ask for a chaplain. If I had any invasive line, like a central line, a Foley catheter, an arterial line, I would daily be like, when are we getting rid of this thing? When this is an infection risk, I want it out as soon as possible. I don't want this in any longer than necessary. If I had just had surgery, I would make sure I was using that incentive spirometer, that little device, to help you breathe in real deep to prevent atelectasis, because I've seen patients get pneumonia afterwards who refuse to do that, refuse to cough and deep breathe, stay in bed huddled up in a ball, and refuse to work with therapy and get pneumonia. So I would be working with therapy and I would be doing that incentive spirometer to get the heck out of there. And if I had any financial concerns, which is a lot of people, at the very beginning of my hospitalization, I would ask to talk with a financial rep or somebody with financial services so that I can have that, if it's a payment plan or whatever, set up before I leave, so I'm not actively thinking about that the whole time.